Good morning, everyone. We're really excited for this webinar. Uh, I am Holly Bell. I'm the Student and Family Rights Specialist for the Utah State Board of Education, and we are going to be talking about supporting the medical needs of our students. And I'm really excited to have Betty Sue Hinkson and Kendra Muir here. And Betty Sue is, hopefully I get this right, our state nurse consultant. And Kendra Muir is our USBE school nurse specialist. I think there's one more in there, but Kendra, how long have you been with us? Because I know Betty Sue and I were so grateful, especially Betty Sue, when you came on board because she was carrying the whole load. And it's been so nice to have you here. And I wanted everyone to get to know who you are so that when there's questions that I can't answer around students with medical needs, that we can bring you in and have the expert knowledge. So I'm actually going to let you all introduce yourselves and a little bit more about what you do, and so that people know the resources that you are. And then I will go ahead and start the slides.
Okay, you want me to start?
That would be great.
Okay, I'm Betty Sue, like she said, Hinkson. I work for the Department of Health and Human Services, and I am their state school nurse consultant. So anything school health related, I support school nurses. I support schools contact me all the time. They don't have a nurse, so if they have any question about that, so that's my role.
And I am Kendra Muir, school nursing wellness specialist. It is a very long title. Basically, I do the same thing that Betty Sue does, but for a different state agency, for the Utah State Board of Education. And we are always available, for questions or emails through if you're a nurse, or just emails if you're a 504 coordinator. So feel free to reach out in the future.
No, I take advantage of that with both of you. Okay, so I'm going to get the slide started, and I think Betty Sue, you're coming in straight from the beginning, correct?
I believe so. Yep.
All right. Hold on. I need to share screen first because we still are trying to perfect Zoom, which is never going to happen. Okay. Almost there. All right, take it away and let me know when you need me to advance the slides. And actually, I can see you.
Oh, great. Yeah, go ahead and advance it to the next slide, if you would. So this is probably not my slide. This is probably yours, Holly, but I can read through it. This does not and is not intended to be legal advice. None of us are attorneys. And so if there's any particular legal question that you have, you should contact your own attorney. Each school should have access to one. And then there's a phone number if there's any requests needed to be made for the ADA.
You did a perfect job on it. Thank you.
Awesome. Next slide. Okay, so this is for the nurses. We have a combination of nurses and other staff attending this webinar today. So specifically for nurses, there are some requirements for the nursing continuing professional development credits. And one of them is just making sure you're aware of what the outcome is, which is posted there. You can read. I'm not going to read that for you. And then next slide. These are also some disclosures that we're required to make. And again, I'm going to let you read those through. It's just some documentation that's required to in order to award the NCPD, the Nursing Continuing Professional Development credits. Next slide. The one thing I want to point out on this slide is I have to put a limit on the school nurses on how long they have to complete the evaluation and receive the credits. So only those who are attending right now or view it off of the USBE website by March 31st, which is Sunday at midnight, will be eligible to receive the 1.5 NCPD hours. You have to have attended the entire webinar and you must complete the evaluation. And there's a link at the end of the presentation for that. Anybody watching this webinar after March 31st, you're welcome. They'll have it posted for a long time. You're welcome to watch it. We just will not be able to award the credits for that, for those completing it after that date.
And for the educators, I've also, as usual, I will send through the listserv the link to the Google form so that you can get 1.5 relicensure points for attending the webinar. And I think I gave you an extra week beyond March 31st to watch the video. And well, actually, you're here, so you're already watching the video. For those who don't get to, who are on the listserv, they will receive the link to the Google form. And if we have school nurses out there who also have an educator license who need this, you can fill out the Google form as well. And I have the instructions on there.
Okay, next slide. Kendra, you're muted.
I am muted. So first of all, to understand how 504 students with 504s and also healthcare plans, how it's important to understand before we begin is how we should be working together. And with that being said, I just wanted to let you notice that so after the 5 principles that are the little white line that's surrounding the 5 principles talks about the standards of practice, which is a foundational for evidence-based clinical competent quality care. And so it also says in there, in that little white line, I don't know if you can see it on your screen, it says coordinating policy and process. And so it's really important that your outlook and your perspective going forward is the idea of working and coordinating care for a student. So nobody should be working by themselves. You should be working with other staff when developing, when say a student has a healthcare plan, it's important to notify your 504 staff and vice versa. If there's some sort of medical need and you're not sure, even if you think you're sure, it's important just to reach out and let the nurse know. So everyone's on the same page and the student has some better outcomes in the school. Next slide.
And I love this. I think part of the problem, when you get to the evaluation phase for Section 504, then you're golden. You've got a team who is knowledgeable. The problem is getting to that point where the student is getting that community of care and making those connections with the school and the school nurse to get the child to the evaluation stage. So this is something Betty Sue introduced me to, this whole school, whole community, whole child model through school nurses. When Betty Sue did the webinar on supporting students with diabetes, and I've just really kept this in my mind as something very important for all of us to understand and to make sure that we're practicing.
Yeah, and the model, although it was created back in 2014, it still holds true. There's a lot of emphasis, but there's a lot of different areas. A student just doesn't have one health condition. There's a lot of different components for health and wellness that go into a student, and it's important for the school just to have that perspective and to also make sure you're including the right people on your team. Okay, so before we begin, it's important to know that when a student has medical needs, they're classified. A lot of our school nurses already know this, but it's important to know that the classifications for students with medical needs, it's based on severity. So, your students with health concerns, the medically complex needs, students that are medically fragile, and then students that are nursing dependent, the needs go up as you go down from 1 to 4. Next slide.
And this is something I learned from y'all, which I always learn a ton on these slides. That's why I bring in, or on these presentations, that's why I bring in specialists. So we had the request to do a webinar on medically fragile students. I had no idea that there was this hierarchy and there were these other terms. So I appreciate that I've learned this.
So first of all, let's go over number one. So student with health concerns. So these are your students that do have a physical or social emotional condition, but they're uncomplicated and they're predictable in their care. So these students might require occasional monitoring by the school nurse. It could be every 2 weeks to annually, depending on their severity of their health condition. And needs. So one thing to remember is that a lot of students, most of our students that we found with medical conditions have mental health issues, but one of those falls under that is our students with ADD or attention deficit disorder. They could also have mild allergies or just something that requires administration of medication. So it's important to note that that if you have a student and you're doing a 504 plan or vice versa, they might have other needs in the classroom that might not be met just with a healthcare plan alone, and vice versa. So again, working together, we'll get through that and we'll give them the best care possible. Next slide. Okay, number two would be medically complex students. So these are the students that may have an unstable health condition and who may require daily professional nursing services. So these students require a licensed registered nurse to first do an assessment to see what sort of care they need. The nurse will then write a healthcare plan, and then she'll teach and oversee the task related to those students' needs, and delegate that to staff employees or school employees who interact directly with the student. Next slide. So examples of this would be any of your health conditions, any of your main health conditions that we see in the school environment. So asthma, they might need their rescue inhaler multiple times per week. They may have frequent health room visits. Seizures, they might have, even though they're on seizure medication, you might see breakthrough seizures. And then of course, severe allergic reactions. Say there's peanuts and there's cross-contamination in the lunchroom. You might see a severe allergic reaction that requires an EpiPen. Also, our students with type 1 diabetes that may or may not be independent in the school. They have they're watched a little bit closer than our students just with healthcare concerns. Next
And
slide.
like I mentioned, the webinar on supporting students with diabetes is still linked on our website, and that's the one that Betty Sue helped on. So, and allergies, we might need to do our own, I don't know, this comes up a lot, allergies come up a lot, and just what you can and cannot do or expected or not expected to do when supporting students with allergies. There's so many allergies, and it seems like it's just increasing. I don't know what that is accounting for that, but okay.
Great. And so the list continues. Mental, emotional, behavioral health. So they may take a medication for that, but they have a lot of dosage changes, so that they would be considered medically complex, or they require sort of symptom monitoring. A student that receives medication in the school may need to be monitored after taking that medication because of frequent side effects. And also, any student that hurts themselves or hits their head, even a head bump, because we know that traumatic brain injuries can progress. So it might not appear as bad as it really is. And so to get that student back in the classroom where they're learning, it's a long process. So make sure that that everyone on the team is involved in that. It's not just a simple they're back, they can learn, because it does require a step-by-step process. And we did write a model head concussion policy. You can find that at the Utah State Board of Education's website, and also on the HEAL website for nurses, you can find that as well. And that talks about return to play and return to learn. And then there's a lot of, yeah, there's a lot of other examples too. So any type of, medical procedure like a catheterization, or say the student has a feeding tube, these students, they all need healthcare plans, and they all need care to be delegated to school staff.
Well, concussions come up a lot, especially with Section 504, because it's really difficult to determine if they're eligible for a disability, because is it going to be long-term? And so the guidance from OCR has been the severity and the expected duration. And so they might not, it might be that you're making sure that they're receiving the healthcare, their healthcare needs for a period of time, and then just keeping an eye on it. It's really hard to know, but it's definitely something that people need to be aware of, that it could become a long-term disability under Section 504. This was our first webinar, was on concussions. That was so long ago. I probably looked like so scared. I don't know. But we do have a webinar on that.
Absolutely. And another thing to talk about quickly on concussions is, in previous years, the emphasis really was on getting them physically active to, say, if it's a sports injury, to return to play. And it's so much more than that. So even if your school has an athletic trainer, if they have a school nurse, if they have a 504 coordinator, all those individuals need to be on that team, because there's so many things that come into play with a student, and of course the student's healthcare provider. We've recently seen a lot of complaints from LEAs that are schools are having the athletic trainer release students back to play, and that actually needs to be in cooperation with a healthcare provider. So it might be a big team, it might be a small team. And again, like Holly pointed out, it really depends on the severity of the head injury. And so it's important that we all work together to get that student learning.
Well, and I, as a school counselor working with students who have had concussions, I've also seen those students develop mental health conditions, and they, it starts to cross over into other health conditions. So.
Exactly. Medically fragile students. So again, the severity goes up as far as medical needs. So these students, they're medically fragile, and they're students that they have a life-threatening health condition, and they require immediate professional nursing services. So students in this category, they require frequent, a lot of times it's daily, one-on-one medical interventions. As students with medical conditions become more stable, the students mature, the category may change. So this isn't like head injuries. This isn't set in stone. Once they have it, it goes on forever, because of course the student is getting better, or they're requiring different accommodations that we see. So the services may in fact become less intense to a medically complex student as they start to heal. So some examples of medically fragile students would be, I think we skipped one, but that's okay. Nope, we didn't. Okay, so examples would be your asthma students. Say that they have to be hospitalized because of their asthma, or they have to be seen in the emergency room. Seizures, they might be having prolonged, like post-seizure symptoms, where like the post-ictal phase, which is a phase after a seizure where they're really not responsive. They really don't move much. They can't do anything. And so these are our medically fragile students. And so it's difficult for, it might be difficult if the student has seizures like back to back. They call those cluster seizures, because, you might think one seizure is over, but it might actually be leading into another. So that would be considered a student who's medically fragile. Also, your severe allergic reactions. So if they have multiple life-threatening allergies, they may need special accommodations so they're not exposed to that target agent that may cause that severe allergic reaction. And of course, usually those students will have an EpiPen um, that's assigned to them. And just so everyone's aware, it is required by law that a EpiPen is at each LEA, so that would be charters and public schools. And so your school should have an EpiPen on campus, and that would be, say, a student receives an EpiPen. Usually one is not enough. You always want to call 911 when they have one, but we have a second one there, or in the case that a student doesn't have one, it's their first allergic reaction, the school is required to have one on campus.
And with these severe allergic reactions, and it usually comes up with airborne allergies, and peanuts are often the culprit. But in general, if it's an airborne allergy, you are not expected under Section 504 to promise a peanut-free environment or an allergen-free environment. As far as airborne allergies are concerned, you can only do the best you can, but that's not an expectation. I mean, if you think about, there's no way you can guarantee that the parents of other students aren't going to send something to school. There's just no, you can just do everything that you can to provide an environment, but just so they know that that's not an expectation under Section 504.
Yeah, and as far as severe allergies, one last note is that there are certain things that can be controlled in the schoolroom or the classroom, and sometimes nurses will write this in the care plan. Students, they might have to have only bring snacks or for birthday parties that have labels on the individual package, so that students are able to identify if there's something in there that they're allergic to. And also this goes with our diabetic students. Schools that have a no snack policy, they don't have to really worry about this unless someone brings something in their backpack, because we know, like with allergies, you can just touch someone and it can cause an allergic reaction if it's on the person who touched their fingers. And I did not say that right. But diabetics who have variable blood glucose levels, like your newly diagnosed students with diabetes, they would be considered medically fragile until either they mature enough to be able to independently take care of their chronic health condition, or till their blood sugars level out. There's a lot of pancreas activity going on as that student transitions to a full type 1 diabetic, and also type 2. Just there's a learning curve there with culture and food, and learning how to maintain that health condition safely. And then we have emotional, mental health and behavioral issues. So any kind of suicidal ideation or volatile behavior as well. That would, of course, require frequent monitoring and interventions. So students that have been hospitalized for a mental, emotional, behavioral health issue may need to be watched and may be considered medically fragile as they return into the school environment. So accommodations may need to be put in place, a healthcare plan if there's medication that needs to be administered, or you can work together as far as checking in with the student on that. And then, of course, miscellaneous, there's always more conditions that would be considered for medically fragile students. But anything that basically puts that student at risk of any kind of life-threatening event.
And I hear more and more just really unusual medical conditions that I've never heard of that, I mean, undiagnosed mental health physical health conditions. And of course I email you, but what would you recommend for our educators or school nurses who are met with these that they've never heard of?
For the school nurses or for the 504?
Well, I imagine this falls in the lap first of school nurses, but they have that contact with the physicians, I would think that would really be helpful.
Yep. So HIPAA, the federal law, does allow school nurses to actually speak with the physician when it's in the best interest of the child, and FERPA would protect that as well. But as far as a condition that a nurse might not be familiar with, we do have our nursing listserv that they can reach out on to see if any other nurses in the state of Utah have dealt with this medical condition. Also, they may already have plans in place. They can make sure that they're not leaving anything out. And then, of course, at the end of the day, a nurse may need to research the medical condition as they're developing a healthcare plan.
Well, and this is one of those examples where for Section 504 coordinators or other school staff, they need to be in communication with their school nurse and really be taking their advice or making sure they're following the healthcare plan and so on.
Exactly. So nursing dependent students, these are our students that they're unstable or they have a life-threatening health condition that could basically occur at any moment. These students require daily, direct, and continuous professional nursing services. And so usually these students, you'll see them with a nurse that will be with them not 24 hours a day, but possibly depending on their care at home. But while they're at school, you'll see one nurse to this one student. And usually the cares and the tasks involved with this, they're not delegated to school employees. And that's what you'll see. Go ahead and go to the next slide, Holly. So some of the examples would be a student that has a tracheostomy or a tracheotomy. A lot of people refer to that as, so sometimes they require nursing assessment. They might have just recently received one, but any kind of compromised airway, severe seizure disorder, tube feedings, or like suctioning of things, it might require a nursing assessment and intervention. So anything that requires that we're not able to delegate that as a nurse in the school. So now the next step of this is just to really understand the role of the school nurse. We kind of explain the students with different medical needs and their severity. So we hear of students with different healthcare plans. And so the term is actually, we sometimes use the term interchangeably, but the actual definition of a individualized healthcare plan would be a written document that outlines the provision of students' healthcare services intended to achieve specific student outcomes. So this is a plan that's actually written by the nurse for the nurse, not for school staff. But the school nurse does receive input from the family and the healthcare provider to write it. So this is the overall brains of the plan. Usually staff don't see this. Sometimes, like I said, things are used interchangeably, but I just want you to understand that there are plans in place that are above, that are sort of at a macro level that don't even specify necessarily what the school staff will be doing and what tasks will be delegating and what to watch for. It may include that, but it may not. And the nurse may not share that with individuals, or they may share it depending on the school. But it's important to note that only a registered nurse can write these individualized healthcare plans.
And this is one thing new I learned. So I knew that the nurses had to write the plan, but I didn't know that that was a document that the other school staff who'd be involved in the care would see. I did not know that. So
yeah, and so if the school doesn't have a school nurse, depending on the health condition, the student really does need some sort of licensed healthcare provider, a nurse, to write that. It can't be an EMT, it can't be a doctor, because the individualized healthcare plan is a nursing document.
Oh, okay. That's interesting.
So another type of healthcare plan, or when we refer to a healthcare plan, we might be speaking of the emergency action plan or an emergency care plan. So it might be the EAP, the ECP. This is a document that's written by the nurse, but it's for other school staff to follow. So usually family and the healthcare provider will provide input on this. The document is usually in the form of, if you see this, then do this format. So that the lay staff or staff that are unlicensed medical professionals will know what to do if they see certain things regarding a health condition. So both the parent and the nurse sign this. So the nurse is already working with the parent, the healthcare provider on these documents. And so it's important to note, and I'm sure we'll say it throughout again, that depending on the healthcare condition, it may require a 504 as well. So just always remember that when the nurse is creating these documents, that she might need to bring more people in, she or he might need to bring more people onto their team so the student, all their cares are being met.
I appreciate that there's document that contains language we can understand.
Absolutely.
We're not in the medical field. And I see that it says the parent should sign. Is it a must? Do they have to sign it? Because in section 504 land, the only thing that they need to sign is consent to evaluate. They don't even need to sign anything else. So is this something that they have to do?
For the student to receive the best care and the best plan of care in the school, it's important that the parents involved, because they know their student best, they know their child best, and they see what happens at home. Sometimes though, we have parents that they're like, oh, they don't need it, just call 911. So in those situations, the nurse has to come up with some pretty creative ways to provide care to them in the school. Of course, it always involves calling 911 in an emergency, but the nurse may have a sort of a healthcare plan there just for staff to see. And so they know sort of what to do in an emergency for that health condition.
That makes a lot of sense. And I have heard that come up. It does come up in section 504 because we want to encourage parent participation. But if you can't get a hold of the parent and the student requires related aids and services and accommodations, then that's in the best interest of the student to provide those. And you would hope that the parent would be involved.
Absolutely.
And often they get involved when they don't like what you came up with.
That's true. That's true. And our main goal is to keep that student safe and healthy so that they are able to learn. So one example of that may be, a severe allergic reaction like we were discussing earlier. There's certain things that you need to do in an emergency. And so even if that student doesn't have a healthcare plan, we always recommend, but say it's the first time they've ever had an allergy, this is important stuff to know for school staff, like what to do in a specific situation. We have had a lot of issues in the schools over the years where school staff will actually witness an emergency, but they don't take action. They don't call 911. And so it's important to have simple written plans in place for all students, even the ones you're not expecting to have issues.
These are scary things. I would be scared if and I imagine if a student goes into a seizure and maybe they're not supposed to move them or things like that, it would be really important for them to know and could be life-saving. And I would appreciate it as an educator because I think knowing this in advance is going to help me in an emergency situation. Betty, so I saw that you have
Yep. I was just going to state that if the parent won't sign this or won't return it to the school, and there are medical accommodations that need to be done, you really can't delegate anything. The nurse cannot delegate anything. And really the only plan would be in an emergency, they would call 911. We have to have parent consent in order to have these accommodations put into place. There are specific laws that have very specific language that the parent has to consent to this care. So that's really important. Those are the more severe conditions. Our kiddos with diabetes, the parents have to consent to us giving care. Any medication law that's been passed, so our diabetes, our seizure rescue medication, our new adrenal insufficiency has language that the parent has to consent to the care before we can provide it.
Absolutely. Especially medications. They can never be administered at school, for a lot of these health conditions unless the parents consented and the healthcare providers consented. So I don't want anyone to get the wrong idea that we would go ahead with care and delegate maybe a staff to do something without the parents' consent. That's absolutely true.
Yeah, thank you for that clarity. And because with Section 504, they can move ahead. If they had consent to evaluate and they come up with a plan, if the parent doesn't sign it, they can move ahead. But there's a lot of things that go into that as far as if they request a hearing and due process and things, but in normal circumstances, they can go ahead and provide them as long as they had parent consent to evaluate. So thank you for that.
So when does a student need a healthcare plan? So this is the question. This is a good time to talk about 504 accommodations, 504 plans. So anytime a student has a chronic or a significant health need while they're at school, they require direct or indirect care from the school nurse, they will require a healthcare plan. So if we're delegating to staff at the school, a secretary, however, the school nurse is not on site, they're going to need a healthcare plan in order to delegate that care. So students that need health services on a daily or regular basis, they're going to need a healthcare plan. If they have health conditions that may lead to a medical emergency, if they require specialized care, they receive health services under an IEP or Section 504. And so if there is health services, they're going to also require a healthcare plan. And then if any kind of care is delegated by the RN to an unlicensed assisted personnel, of course, that healthcare plan is necessary. I just want to point out on this, though, a lot of times, just daily cares of students sort of get mixed up with actual medical needs. So diapering and toileting, those are not health conditions. Those do not require the nurse to make a health-related accommodation because it's not a nursing function. So we can only delegate care that a nurse normally would do with some exceptions.
Well, and a few things about the emergency care plan and the individualized healthcare plan that I try to remind people. It can get confusing because people think that sometimes with an IEP, you also need a Section 504 plan, which is not the case because anything on a Section 504 plan can be written into an IHP. But that is not the case with any of these healthcare plans. They need to be separated. Anything that's an accommodation for the classroom, for the school, for school programs and activities should be separate in a Section 504 plan. All the healthcare related needs need to be in these other plans that are developed by the school nurse, and they need to be kept separate. Part of that is just the fluid nature of the plans that the school nurses create. They're constantly revising them, and you don't have to go through this process of amending, with a team and all of that. So I want to make sure that I drive that point home. And we'll talk about what some of those accommodations might be that accompany those plans in my section later on. Is there anything you want to add to that?
No, I absolutely agree with everything you just said. So with everything we just talked about, so the nurse at the school nurse at your school would she or he identifies and they assess the students, um, and they decide sort of not decide, but they based on that assessment, they're able to decide what health related accommodations are necessary so that student um, can learn best. So sometimes even if you think that a healthcare plan may meet their needs, it's important to always note though that, like Holly said earlier, a Section 504 evaluation should also be considered anytime a nurse is planning care for a student, and that the student should be referred to a 504 evaluation if they're going to need, especially if they're going to need some sort of accommodations in class, like you know, maybe frequent restroom use or, you know, some delays with testing or testing alone, things like that. Always consider referring to your Section 504 coordinator.
And
And
it's
then
always
also,
better to be safe than sorry. So,
absolutely, yeah.
because they
And
can
it,
always do the evaluation and they find out that they don't need a plan.
right. And it also sort of promotes and continues that relationship and that coordinating of care between the Section 504 um, coordinator and also the school nurse.
Yes.
Um, so school nurses also, especially when it's a health related need that the 504 team is writing accommodations for, the school nurse should be a part of that team. And then also if a student qualifies for a Section 504 plan and a healthcare plan, like Holly said in the last slide, it's important to complete them separately, because again, the healthcare plan should only be written by the school nurse. But uh, you know, a nurse might be able to provide valuable input for a Section 504 team when they're planning accommodations. Um, and not all healthcare plans, most healthcare plans do not include the academic accommodations. So you're not going to see in a healthcare plan something about testing or turning in late assignments, or you know, maybe they leave class early, things like that. You should really see those in a 504 plan.
Thank you for for having that in the next slide.
Did I jump ahead?
No, I jumped
Oh,
ahead.
okay. No problem.
You would have covered what I just.
That's okay.
Oh, thanks. I'm glad that it was accurate on my part.
Yes. So also the school nurse, part of their role is to determine the different tasks that may be appropriate for delegation. And so say you're not sure and you're like, I can't remember what they said about toileting. You can still go to your nurse and ask if that's something they'll delegate. I'm telling you now that they'll probably say no, but you know, it again, it refreshes and it continues that relationship, that working relationship that you'll have between the school nurse and the 504 coordinator at the schools. Um, the school nurse also will train any unlicensed personnel to perform health related interventions when they're required. And then delegation of nursing tasks, only the nurse can determine if delegation is appropriate in every situation. So again, it's important that everyone is involved, everyone's discussing this on the team, and that way the student receives the best care. And another note is that because the nurse may be required to supervise, and the nurse is required to supervise and evaluate how the staff is performing that care. It's part of the nursing role, and it can't be overlooked. So sometimes the nurse may go back, say after they've taught them how to do a medication, but maybe there's some questions that the staff may need further training on that. And the reason that I pointed that out is it's under the school's nurse's license. So a school nurse is licensed with the state of Utah, but they have certain things that they have to meet, certain requirements that they have to meet in order to hold that license. So there's certain ways we do things so that we're able to meet the standards of care and also delegate what care that we can in the school environment.
So you would say that toileting is a 504 related service. That would be
Yes, it keeps the
504.
student in their seat, but it's not, I mean, toileting is a basic human function, but it doesn't mean necessarily there's a health condition or something's wrong with
Yeah,
that student. We expect students to use the restroom. Some of them just aren't able to complete the task, hygienically,
right.
by themselves.
Well, this has become more of a conversation because in this last legislative session, they passed a bill where kindergartners were expected, they are expected to be toilet trained unless they have an IEP or a Section 504 plan. And so with this being a conversation, I would recommend if a student in kindergarten is not toilet trained, that they consider evaluating for, most likely a Section 504 plan, because there could be potentially a disability. It's a thought. It's come up now that they've made that the law that they have to be toilet trained.
Yeah, and you may see healthcare plans written in some situations say that the student is actually having issues with toileting because they have an infection. So you may need to involve the school nurse, you may not. It really depends on each student and their needs. So it's important to note that not all tasks can be legally delegated. So we cannot delegate to any staff at the school to write the healthcare plan. Again, that is a nursing document written by the nurse. Also, case management. We cannot have the principal, the vice principal, sort of managing that student's care while at school. That really falls under the school nurse because they're a licensed healthcare professional. And then training staff on specialized procedures. We have a lot of, students with special needs that it might seem easier just to have maybe a teacher that's knowledgeable and has been trained to teach someone else. But really, it has to go through certain channels. There's certain things that nurses are watching, they're evaluating that goes beyond just a task and what someone is able to do for that student. And then any kind of complex specialized medications or procedures that require a nursing assessment, so the nurse has to decide something, those tasks cannot be legally delegated either. Then, of course, you have your students with tracheotomy or tracheostomy care, and then deep suction could never be delegated because it requires nursing assessment before and after.
Well, I don't know if any of these are things that parents can do at home, but I definitely want to drive home the point that schools cannot require a parent to come to the school to perform any of these tasks. That is something that would violate Section 504. You can't require a parent to come on a field trip to provide any of these. If you have to have a school nurse, then you have to have a school nurse, however you make that happen.
Exactly. Yeah, or any, just like with any licensed health professional, you may have a school nurse that is just assigned, a one-to-one for that student, and that may be the case, if they're not able to delegate that care.
Okay, this is me. Under Section 504 eligibility, typically we talk about substantial limitation to one or more major life activities. And the Office for Civil Rights has provided a list. It's not an exhaustive list of those, but they've also provided a list of potential major bodily functions that if those are substantially limited, that they could qualify under Section 504 as a student with a disability and may require a 504 plan. Not necessarily, because not all of these major bodily functions, they need accommodations in the school, but often they do. This is the list that they've provided. I don't try to read them or pretend I know anything about them. And if either of you want to provide any clarification, that might be a longer conversation, but this is the list. Okay. I always want to drive home to be watching for the red flags under child fine if a student might need to have an evaluation under Section 504. And this would be when we're aware that there's a chronic health condition, when they have an IHP or an EAP, what was the other one? An ECP, Emergency Care Plan. When they know they have a medical diagnosis, but keep in mind, they don't need to have a medical diagnosis in order to qualify under Section 504. Also, when they return to school after a serious illness or injury, that includes something like a sports injury, a suicide attempt, if they're receiving cancer treatment, if they're, things that they have been hospitalized, especially for an extended period of time, and thinking about that transition back to school and if they would qualify under Section 504. If they know that they're taking a medication, and if they know that they're seeing an outside healthcare provider. And I just want to point out with this list that most of this, the school nurse is going to know about. And so this is where we maintain communication with our school nurses, our parents, our administration, our, 504 coordinators, our school counselors, whoever is going to be looking at what the child needs when they return to school. I have had situations, very disappointing, where I've had situations where, as a school counselor, where I had no idea that the parent or that the student was out of school for any sort of services. And I could have been helpful in making sure that those accommodations or related aids and services were provided. We need to make sure we have that whole school, whole child model. And here is just an overview of the 504 process. We're making sure that we're referring, and that can be anyone. It's the school nurse can refer, anyone can refer for a 504 evaluation. And we need to identify the student's needs, their individualized needs, and be as specific as possible in determining related aids and services and accommodations. Now, a lot of these are going to be in the individualized healthcare plan, the emergency action plan. I need to learn these terms because this is new language for me. Emergency care plan. Am I getting them right? Okay, so a lot of these are going to be in there, but we need to make sure that we're matching up with those that we're accompanying what the student needs in school. And we need to make sure we're notifying teachers and relevant staff about the plan and accommodations and their responsibilities. I want to remind you all, this includes substitutes, volunteers, anyone that is going to be interfacing with these students in any program or activity. They need to be aware of what the students' needs are. You don't get a break because the teacher wasn't there. You don't get to say a student doesn't get their free and appropriate public education today because the teacher's not around. That's not okay. So keeping in mind that our temporary staff need to be aware, and also being willing to modify the plan. And I would imagine with our students with medical needs, there could be a lot of different modification, like you said, adjusting medication levels, which is in the emergency action plan, but that's going to probably also affect their ability to engage in the classroom and access that care and so on. And so we need to be flexible. And you could do an amendment to a 504 plan without having an entire meeting. I've got an amendment form online. If it's something that's just pretty obvious that the child needs amended their plan, you can do that without having a big formal thing. And then you need to make sure you're documenting the implementation. Okay, under And I've tried to make sure everyone knows that under the 504 regulations, the term, as far as in the subpart D that we oversee for K through 12, they don't use the term accommodations. That's more the court cases and so on, that have started to adopt that language into the Section 504 landscape. But related aids and services are included in the regulations. And this is something that comes up a lot for me. I get a lot of questions. People misunderstand that you can have these related services in a Section 504 plan. A lot of the time, you'll see these types of related aids and services in an IEP. They can also be appropriate under Section 504. For instance, speech and language pathology, interpreting services, physical and occupational therapy, orientation and mobility services, recreation, including therapeutic recreation, medical services for diagnostic or evaluation purposes, school health and nurse services, and then there are mental health services, and early identification and assessment of disabilities and audiology services. These are examples that the Office for Civil Rights have provided. And these are related, that's not actually defined with OCR. This is something that the courts have said that they apply similarly. And it's that schools are supposed to accommodate or to the extent that they enable the school to meet the individual needs of the child as adequately as it would meet the needs of non-disabled students. And again, just like everything else, it needs to be decided by a group of knowledgeable individuals. Please include the school nurse. If you don't have one, please access one to have that, offer that knowledge to the 504 plan. And that is related aids and services. So let's talk about some of the accommodations, which I think of more. I really appreciate using it under these circumstances, even if it's not in the regulations, because to me, it more clarifies the academic environment. So permission to leave class early, which you mentioned, and this is early, not just necessarily to use the restroom at any point in time, but there might be medical needs where they can't. There's some students that have fragile bones and things where they need time to get to class so that they're not bumping around in the hallways, which can be detrimental to their health. And this is something Betty Sue and I have talked a lot about as far as monitoring blood glucose anytime, anywhere, and eat snacks, even if it's eating snacks in front of other students. If it's monitoring their blood glucose in front of other students. I mean, we can hopefully, I think I read a case where a student would go behind a closet in the classroom or something, but they need to be able to do that anywhere at any time. And some dietary considerations. Now, this is something that has come up a few times recently. If you have a student with allergies or for some other reason, diabetes, that they need to provide an alternative for the student, because that's what they're doing. They're providing for the dietary needs of the general student population. They need to provide something. But it doesn't, sometimes parents will request a specific something, a specific brand. If that's the only brand that there is out there that will provide nutrition to this child, then you need to provide that. If not, that's something you can choose the option that still meets the needs, but isn't exactly what the parent would like. And that goes for any accommodation or related aids and service. The parent cannot determine exactly what it is that will meet the individual needs. They can make recommendations.
Right. An additional thought on that, dietary considerations. Be sure you're working with your lunchroom staff because they actually have the forms that you need to fill out for those dietary considerations. And they can be very helpful if they're aware of what's going on. You can also find the forms on the Utah State Board of Education website under our child nutrition program.
And we can make sure that when we send these slides out, that we include the resources that you've mentioned so they know exactly where to find these things. Also, something that they need to know is if you have a student with diabetes, you're not required to provide them with the snacks that they need throughout the day. If you're providing snacks for other students, then you need to give options. But if this is something that's required medically, you can correct me if I'm wrong, but the student doesn't need to buy the food that will boost the insulin and that sort of thing. I do know there are teachers who will do that out of the kindness of their hearts, or other staff. They need to make sure that they actually can give those to the student. And that is something that some of them will do for any of their students who maybe, not just with medical needs, but who have food insecurity and things like that. Our teachers have very kind hearts.
And those dietary considerations, like you sort of pointed out, they can be very expensive, for a special diet.
Yeah. And transportation accommodations. We are talking about transportation in any function. We're talking about getting to school, getting home from school. We're talking about going on field trips. We're talking about getting to any sort of extracurricular activity. These services need to be provided. So if that means that you need to send us an aide that you can delegate these tasks to on the school bus, returning, arriving and returning, or if you need to provide a school nurse in those circumstances. And I guess typically that would be a student that has a 1-to-1 aide most of the time or all the time. And so please don't think, well, it's only when they're in school. No, it's wherever they are at. You need to provide that service. And this is something that we recently talked about in our meeting. This includes sometimes if they want to attend a function. So they're not just playing on the field, but they want to attend. And this is something you might need to work out in order for them to be able to attend as a spectator. That's something that surprises people, that if they just want to go watch a school play, that is something that is a program or activity sponsored by the school. And so students, all students need to be able to participate. Also, attendance requirements. This is something we need to be flexible with. If they're missing a lot of school appointments, please, if you have an award for attendance, first of all, stop. Please stop. Because we don't want our kids coming to school sick. First of all, any student, even if they don't have medical needs, we don't want them to come to school sick and be contagious just to get an attendance award. But that said, if a student who is missing school because of medical needs and you deny them this attendance award because it's your policy, not a wise idea. Also, there are some times that students need electronic devices with them in class to monitor the health condition and for a lot of other things. If they have attention deficit hyperactivity disorder, sometimes, noise canceling headphones and things like that are necessary within the classroom. So if you have a policy that's a blanket policy that they can't have a phone in class or things like that, you need to make exceptions for some of these students that need those devices.
Another point too is, anytime the student has to use the restroom, they, if say they have to use it more often or there's an issue with it, they might need accommodations to be able to use the restroom. We don't want to have accidents, when someone really needs to use it, because there's a policy in place that doesn't allow them to during the first 15 minutes. I mean, I've heard all kinds of different rules that don't fit every single student out there.
And they need to, part of Section 504 well, what Section 504 is that they need to have access to general education curriculum and all programs and activities. So that means if they are missing some of the content because they have to leave for the restroom frequently or go down to the nurse, the office for medication or for whatever, that we need to be making sure that they are provided with whatever the content is that they missed. That is our responsibility. So if you have a starter, like I said, during the first 15 minutes, make sure that they get that starter. Or excuse it. Do that. Okay. Only if it doesn't have like relevant to the content. Okay, anyway, so here's some best practices for transition back to school. And this is something we talked about in one of our other, Betty Sue, did you help me with this part? So we made a transition form, and I believe that you were involved in that. And of course, we need to make sure that everyone is aware, and that's part of this back to school transition. So if they have been receiving some sort of medical care or treatment outside of school for an extended period of time, we need to make sure that we are helping them transition back in. And we did create a form. I'm going to show you that, and it is online to help get everyone on the same page in their role doing this. And so, and this comes up a lot with concussions too. Okay, so we're going to identify a point person to support the student. That's not just the school nurse. This might be a school counselor, administrator, someone who's going to be your point person to coordinate some of this. And we need to make sure that we're communicating the critical information within the support team. Consider our attendants when they're returning. They might not be able to stay an entire day. We might have to ease them in, and that could be potentially, I mean, when I think about our students with concussions, there's only so much content I think that they can focus on during the day, like comprehending and assimilating, and they might be overwhelmed from also what they've missed. So let's think about our attendance plan. And when we talk about developing a crisis plan, I would imagine this would look like the emergency action plan that you were talking about. And scheduling a 504 meeting or an IEP meeting to go over what necessary related aids and services or accommodations the student needs. Having a clear plan for addressing long-term issues with homework and absences and attendance. So daily check-ins with the student, and daily check-ins might not be necessary if the 504 team determines that that is necessary, or if it's something that the school nurse needs to do. But check-ins with the student to make sure that we're tracking their needs and their progress, and providing regular feedback to the caregiver on their adjustment or how the accommodations are working, what you're seeing, making sure that you're trying to communicate, and provide family peer-to-peer support if available. I always say, you can't put any responsibility onto peers in a plan, but if it's something that can be provided on a voluntary basis, that's something you can consider. Okay, so this is what the reentry plan looks like. And this is something that you should make copies of so that everyone who is a part of this plan understands everything that is there. We don't have a person responsible for completing the form necessarily, like there's a blank spot there. So if you have a point person that can be responsible for completing the form and making sure that it's getting to everyone who needs to be involved in the process of transition back into school. And it sounds like what Kendra said is we've got even more resources for those students who have concussions who are returning to play what you mentioned.
Return to learn.
Yes, that. That's the one. And these are some things that would be inappropriate. A one-to-one aide under most circumstances. We're not talking about a one-to-one nurse that would be required for the medical needs, but a one-to-one aide is typically not. It's not that you can't do that under some circumstances, but typically not. Waiving all their academic tests, they still need to have access to their curriculum and a way to demonstrate competency. But like I say, as far as modifications, you can give them a different way to demonstrate competency. When we're thinking about our students who have had concussions, they're in a computer programming class, they can only have limited time on a screen. If an academic test is on a screen, we need to try to find something else in order for them to demonstrate competency in the concepts, because we're not excusing them entirely. Even if we have to extend beyond the quarter or something like that, we're not waiving everything. And then we talked about this, can't require parents to provide related services, and we can't prevent the school nurse from being allowed to contact the provider. And here's my reminder, we're going to say this 50 times. We are a whole community, whole child, whole school model. Okay, Betty Sue, I think this is you. You've provided some great case studies that everyone enjoys.
Oh, yeah, let's get started with a few case studies. Chloe is a student with a feeding tube who receives a feeding over 45 minutes twice a day during the school day. The school nurse has delegated this feeding to a classroom aide. Does this student need a healthcare plan? And we can't get yays or nays from the participants. So I will go ahead and tell you that yes, this student does need a healthcare plan. Wait, back. That wasn't I didn't have a separate slide for the answer. So yes, they need a healthcare plan because the nurse is delegating this feeding to a classroom aide. But I'm going to have to ask Holly this question. Does this student need a 504 plan or an IEP?
Oh, I am off. Okay, so the student with the feeding tube.
My answer would be maybe.
Yeah, I mean, typically it's a maybe.
Likely up to the 504 team to determine
Yeah.
whether they actually need that. Okay, now you can go to the next slide. Now we're going to talk about Jaden, who's a student with diabetes who has an insulin pump and a continuous glucose monitor. This student needs assistance throughout the day and is not independent. The school nurse has trained staff to help care for the student during the day. And I'm going to ask the bottom question first. Does the student need a healthcare plan? Yes, they do, because again, the nurse is delegating the care that's being done for this student. And does the student need a Section 504 plan? And in almost every case, a student with diabetes should also have a 504 plan. Or if they are a student served by special education, then it would be addressed in their IEP.
And this is one of those that has been clarified that most likely they should be referred if they have diabetes and will most likely qualify.
That doesn't mean the parent will participate, and maybe it won't happen, but they should at least be offered that. Okay, the next one is Cooper, who was in an auto accident and broke his leg. His leg is in a full cast, and he needs to use crutches to get around the school. Does he need a healthcare plan? Probably not. If he's able to walk around independently, then it's not something that the nurse needs to help with. But does he need a Section 504 plan? Holly, what would you say?
We're going to say, so this is something that comes up that kind of is along the lines of concussions where what's the expected duration? Because a broken leg might be a temporary impairment that doesn't qualify the student as a student with a disability. And so it might be just that they need some accommodations as the student heals. But if we expect that there's going to be some long-term paralysis or, well, they're not paralyzed, but something long-term, they might qualify. But if it's a temporary impairment, typically no.
Okay. So now we're going to go over a few OCR cases. This is actually one that happened in Utah. So I'm going to read it because every line has something that's specific to it. The 504 plan for a first grade student with diabetes required the school nurse to troubleshoot issues with the student's insulin pump and conduct changes to the pump in the school nurse's office. The district's legal counsel and state risk management advised the school not to perform the procedures because it would expose the district to potential liability. Therefore, the school refused to adjust the pump site, which is where the pump is inserted just under the skin to deliver the insulin to the tissues. As a result, the parent had to come to the school to make the adjustment. Was this a violation of Section 504?
Yes. And I know where this case happened.
Yeah. Next slide. And the OCR decision was, yes, the district violated Section 504 in Title II when it declined to implement the provision in this student's 504 plan requiring the nurse to readjust the pump if necessary. Districts may not refuse to implement a health service a student needs to receive FAPE simply because doing so would expose the district to potential liability if something goes awry. If the 504 plan requires a service, the district must either implement it or make appropriate changes to the 504 plan. Here, this was specified in the 504 plan that the nurse would adjust the insulin pump at school. And so the legal counsel made a wrong, they advised the wrong thing. And later, OCR found that the district took sufficient steps to remedy the violation, and it agreed to adopt the protocols and guidelines, allowing the school nurses to make the changes when necessary. So that's how they resolved this case.
And I just want to drive a couple points home on this one, y'all. Yes, we all trust our legal counsel, but we shouldn't always trust the knowledge of our legal counsel because they're not specializing in all of these things. In fact, I don't know a lot of attorneys that specialize in civil rights law in our state who could actually give you correct information, but there are people who can. For instance, Betty Sue Hinkson and Kendra Muir and Holly Bell and OCR. So you can contact these individuals, and there are also some consulting firms like Spedco, I believe, who are going to give you accurate information. You cannot always get accurate information from your legal counsel. Always double check, especially if a red flag goes up that, I don't know, this sounds wrong.
But keep in mind that none of us are attorneys. And so the give is our opinion.
Yes. Remember that first slide?
Our interpretation. Correct.
Yeah, that first slide, we're not legal counsel.
Okay, this is another case from Utah. A district prohibited a student with diabetes from carrying the pre-filled syringes in his bag. The student's Section 504 plan did not allow him to carry the pre-filled syringes. The plan said nothing at all about pre-filled. And the student had a full-time nurse who carried the insulin and syringes. Was this a violation, Section 504?
I remember this case, and the district won this case, and I believe it was because we did not know what was in the syringes, correct?
That's correct. And so in this particular case, you can move on to the next one. Slide, but in this particular case, the district did not violate Section 504 because it was not listed in the 504 plan that the student should be allowed to carry the medication. And the school rightfully determined no, that he couldn't carry it because you don't know what the parent put in that syringe. You would hope that it would be what it was expected to be, but the only way to know for sure what when a student with diabetes is given insulin is when the trained staff draws it up themselves. In that particular case, when it's a student using syringe and vials, OCR closed this parent's complaint. So,
I know which district this is too, and yeah. I will say, in certain circumstances, you need to be very specific in a 504 plan, such as this. In other circumstances, you may need to be more flexible when we're talking about extended time and things like that, to be a little bit more flexible. So,
Okay, this last case I'm going to go over isn't from Utah, it's from Texas. And it had to do with a district that didn't do 504 plans. They provided healthcare plans instead. And OCR determined that that was a violation of 504, that they needed to evaluate the student's eligibility for Section 504 and related aid and services, rather than just think that a healthcare plan would suffice with that.
Yeah.
And then,
oh, I put this one in here.
okay, that's you.
I thought it would be good to put this case in because it's very different than any case that I've seen. And so I'm going to read this. We've got a 12-year-old medically fragile student who is paralyzed from the neck down and dependent on the use of ventilator for life support, needed catheterization, suctioning of his tracheostomy. I looked that up because it said tracheotomy and I looked it up. Okay, I was very proud of myself. Their tracheostomy tube, monitoring of his ventilator, ambu-bagging, assistance with food and drink, and positioning. So I'm asking, did the Supreme Court determine that these were reasonable related aids and services for the district to provide the student? Actually, the student health care needs did not fall within the medical services exception to the IDEA, but rather where school health services were school health services that the district was required to provide as a related service to assist the student with his education. They were required to provide these accommodations. They were not considered unduly burdensome. And so what happened, because it's an increased expense to the district to hire a full-time nurse, hopefully not fire, because we need our school nurses. And which was these are not delegated, right? You can't delegate them. That they would range between 20,000 and 30,000 annually, and they had to do it. They had to pay for it. So I thought this was
that's a low estimate.
Well, yeah.
And maybe this was a long time ago, but anyway.
You know, that's a good question. I can't remember what year this was.
Okay. So this is a question that came up in a totally separate meeting. We had a school nurse that asked the question, do all students with a Section 504 plan or an IEP need to have a school nurse on the team? There were, I guess, well, no, I'm heading in a different direction here. So yeah, at what point, under what circumstances does a school nurse need to be on the team? And the answer on the next slide is no, they don't. A nurse doesn't have to be on every 504 team and every IEP team, only if that student needs health or medical accommodations. When a student does have health or medical accommodations that need to be made, then absolutely the school nurse should be a part of that team. Some districts were requiring several years ago, many years ago, were requiring that a school nurse be on every 504 team, and that's just not appropriate. It's not an appropriate use of their time because many school nurses cover so many schools. It was an undue burden for them, and it just wasn't appropriate if they were not talking about health or medical accommodations that student might need.
Well, and I want to make a clarification for them because the definition of a team is a team of knowledgeable persons of the child. So a lot of these school nurses might not even be working with this child, so they can't give information specific to this child's needs. The 504 plan is supposed to be specific to the child's needs to access their free appropriate public education. But there's a difference when it comes to gathering data. And so you can consult with a school nurse to say, hey, we've got a situation with this student who we want to write a 504 plan, and what kinds of things should we be considering given the nature of this child's disability. But that doesn't mean they're on the team, but they can be a consultant and provide some information. And they don't need to do that either. Hopefully, I think that our school nurses who are working in the schools have the better, have a lot of knowledge to provide. But we can also answer questions. So, you know, like you said, what's the ratio again for school nurses to students? Isn't it like 1 in 1,000 or something?
Or it's more like 3,500, one nurse
Oh.
to every 500 student. And we have significantly improved that. It used to be one nurse to every like 6,000 students.
Oh, so there's no way they're going to be knowledgeable of every single student unless they have really medically fragile, medically complex needs. Did I get that right?
Yep, sounds good.
Yeah, and they also recommend, the state recommends one nurse per every 2,000 students. That's just a recommendation, but just so everyone has a ballpark of how many students should be in a school, or how many nurses should be employed by a school
So
And
just a
or
final, sorry,
district.
go ahead.
final note that not all students with a healthcare plan are going to need a Section 504 plan, but all students with a healthcare plan should be evaluated for the need of a 504 plan. And not all students with a Section 504 plan will need a healthcare plan, but it's a good idea to bring your nurse into it to evaluate those students and see if they might actually benefit from having a healthcare plan in place. Just that final reminder.
And I just want to say, when I was in elementary school, the school nurse was one of my favorite people. The school nurse was somebody I really trusted. And so the school nurse doesn't just provide healthcare, you know, they provide a person for a student to trust, for them, you know, that they will care for them. And so our school nurses provide so much more than just these medical needs. They provide a student, another person for a student to trust, that they care for them within the environment. So give our school nurses the credit that they deserve and the care that they deserve.
Yep, absolutely. Absolutely. So just to remind you, those of you who are school nurses and who want to receive 1.5 MCPD hours, you must complete the evaluation by midnight Sunday. I will work on completing or emailing those to you. It's actually going to be a week after April 1st because I won't be working the whole week of April 1st. But there's a link or the QR code, whichever is easier for you, to access that evaluation. Must be done by Sunday at midnight. So those watching the video after that date will not qualify for those hours. Thank you.
And I hope you're doing something fun and not work.
I'm moving.
Oh, that's right. You build a house. Okay, that's like fun
Not
work. Not fun work, but it'll be worth it in the end. And this information will also be sent out in the Google form. And like I said, for nurses, if you click that you're a school nurse, it will take you right to this information. Then for everyone else, please you'll fill out that form. And you do have, for anyone who maybe missed this, there will be some time to fill this out, and you'll have an additional week past this to get credit. And this is just, I want to make sure that when we're talking about inclusion of our students with disabilities, that this includes paying special attention to our students with medical needs. And this is a definition that just came out in one of our board rules, R277328. And the definition in there was that inclusion means ensuring that students are accepted and valued as members of the school community with equal opportunities to contribute by creating conditions for meaningful participation. And the special ed rules they're really making a lot of effort to talk about inclusion. They have an inclusion model that they've created. And so we need to make sure that these students are included in the classroom. And we've got some OCR guidance here. I'm going to be sending you some more resources, ones that we talked about, and additional resources. And here's our contact information. If you are not on my listserv and you want to have that form sent to you, please shoot me an email so I can send that to you. Any last words, Betty Sue or Kendra? Nope. Okay, we are ending 1 minute before. That is really cool. Okay, I appreciate you. Have a wonderful day. For those of you who are having spring break, wow, you're here. And if you're having a spring break coming up, then have a good time. And we're here for you whenever you need us. So, except for during spring break or while Betty Sue's moving. All right, take care.